earlier I mentioned a couple things. I mentioned engorgement and I mentioned mastitis. So engorgement happens when your supply of milk is too much for your baby's demand. So your breasts fill with milk and they become taut and painful and warm to touch, but there's no redness or anything, they're just really full. This can be extremely uncomfortable. So how do you resolve this if it happens? Well, there's a few strategies. Keep moving the milk from your breasts. That is the best way to resolve this problem. You want to do breast massage and you want to feed your baby frequently. Look for baby cues, feed on demand, feed his baby as much as you can. You may have trouble latching because it makes your nipple flatter because of how full they are. So what you want to do is you want to hand express. And we'll be discussing hand expression, or I'll show you a link for hand expression so you can see exactly how we do it. You just hand express a little bit off the nipple just to soften it up so that the baby can get the nipple in its mouth. Ensure you have a proper latch and baby's positioned properly. If you're experiencing pain from the engorgement, speak to your doctor. Sometimes anti-inflammatories like ibuprofen can help, but speak to your doctor before you take any of that and take as directed. Another odd thing, and I'm actually not even sure why this works, but it's cabbage leaves. You take a cabbage leaf and you get it cold. So you can put it in the freezer, you can put it in the fridge, and then you put it inside your bra. And that can help relieve some of the pain and inflammation as well. So helpful hint, if you do put cabbage leaves in your bra, don't fall asleep if you have a dog in the house, because your dog will come and try and eat the cabbage out of your bra. Very rude awakening. You can also add ice or cold compresses. Make sure you're wearing a supportive bra, but not too tight because that will add to your pain. If baby's sick, say baby's sick and not breastfeeding, and that's the reason why you're having the engorgement, then pump off a feed. Take a pump off a feed, and store it for future use in the freezer. So as I said, there is a link for hand expressing, and it shows you exactly how to do it. It can be difficult to learn, but once you get it, it's a great way for removing milk from your breast. It's actually even more effective than pumping. So what happens if you have the engorgement, or what happens if it turns to mastitis? And what is mastitis? Well, mastitis is an infection in your breast. It can be an infection in your milk ducts or your breast tissue. So how do you know whether it's engorgement or whether it's mastitis? Well, mastitis, because it's an infection, you'll see certain signs and symptoms. One of them is redness on your breasts. You'll have a fever, you'll have flu-like symptoms, and you'll have a lot of pain. If you have any of these symptoms, please contact your doctor or 811 to get advice on what you do. However, with mastitis, there's a good chance you're going to require antibiotics, so you will need to see a physician. Now, your breasts are really going to hurt. When you have mastitis, you're not going to feel well and your breasts are going to hurt. And I know your first instinct is going to be, I just can't breastfeed anymore, this is too painful. But actually, one of the best cures for mastitis is feeding. Empty your breasts. Get the milk out of the ducts. And in case you're worried, I have an infection, should I be feeding my baby? Your baby will not get sick from mastitis. You can also try things for mastitis just like you would engorgement. Supportive bra, cold compresses, something for the pain as directed by your physician. It's recommended that your baby breastfeed for at least 6 months, its first 6 months of life. Anything above and beyond that is just gravy.